crisis in Chicago. 72% of deaths in the city have been African Americans, despite black Chicagoans making up just 30% of the city's population. Also, 50% of confirmed cases in Chicago are African Americans. Doctors and health officials say the COVID-19 pandemic is making it even tougher for underserved communities to get the care they need. And many underlying conditions such as diabetes, asthma, and heart disease make them more vulnerable.
Joining us now for more on this topic is Dr. Regina Benjamin, the 18th U.S. Surgeon General and member of the American Heart Association Board of Directors. Thanks for being with us.
Good morning.
Good morning.
Good morning. Talk to us about why this seems to be affecting minority communities at a higher rate.
Well, we know that the coronavirus attacks people that are vulnerable, the elderly and the people with pre-existing illnesses. So what we didn't realize is that, or we didn't think about, was that these pre-existing illnesses were things like hypertension, diabetes, pre-diabetes, asthma, those things that you just mentioned. And yet they put us at higher risk. And so it's not surprising that we see the numbers go up in that population. But what we didn't expect was for minorities to be much sicker, much faster, and to die more often. And that in itself is a surprise. And the American Heart Association has been noticing that people with underlying cardiovascular disease, particularly arrhythmias or irregular heartbeats, are being affected more and having poorer outcomes. And so we put in $2.5 million to do some rapid research around how cardiovascular disease is being affected by the COVID-19.
This administration has gotten a lot of heat for not being prepared, but I saw an interview with Dr. Falchi from 15 years ago saying that the United States was not prepared for a pandemic. How can that be?
Well, when I was in office, we had constant preparatory things. We had gone through H1N1, we went through Ebola, we went through the oil spill on the Gulf Coast, and so there's always been preparations. But I think no one can prepare for everything, but we can try our best. And as far as what we did or didn't do, we'll have plenty of time later to look back and see, and to do what in medicine we call the autopsy on what we did right and what we didn't do right. But for now, I think our really goal and my goal is to make sure we save lives and protect as many people as we can today and keep them from getting sick today or tomorrow while we go through this.
The biggest, hardest hit areas have been urban areas, but you say it's the rural communities that might be the next at risk. Why?
Well, the same reasons that we have the minority populations. We know that your zip code is a better predictor of your health outcomes than your genetic code. So it's not necessarily the fact that we're minorities, but it's the fact of all these social determinants of health that we've talked about. When you look at the rural populations, we have physical inactivity, we have high blood pressure, we have diabetes, we have obesity, the same things that lead to heart disease that we have in minority populations. So it will not be surprising if we start to see more and more cases in the rural communities. We're at risk as well here in our rural areas.
Well, Dr. Regina Benjamin, we appreciate you joining us this morning.
Thank you. I would say also that just continue social distancing, washing your hands, doing the things that the public health officers are asking you to do. It really can improve resilience and help you fight off any illness or disease, including COVID-19.
All right. And for more information, you can go to the American Heart Association website at heart